Bronchial challenge test, the standard way to diagnose asthma. Here is a scenario. You visited a clinic with your 3-year-old daughter or son, and you've seen, it might even be your own family physician, okay, and the doctor has told you, well, the signs and symptoms here are pointing to asthma. Right now, I cannot send this child for the test that will help to make the definitive diagnosis of asthma. I will do one thing anyways. I'm not going to leave your child unattended to. I will place him or her on Ventolin, and depending on the history, how severe it is, also on inhaled corticosteroid. And at age 5, I will send your child to the specialist who will be able to carry out the test to make the definitive diagnosis of asthma. The test he or she will make mention of is bronchial challenge test. So sit back and get the full pieces of info on bronchial challenge test right here. Without further ado, let me quickly say a big thank you for visiting my channel and listening to all my presentations. Please remember to subscribe if you haven't, but if you are subscribed and you are visiting again, I'm saying a big thank you. And also remember to share my presentations with all your friends. So, with that said, let's get down to business. Clarification. This presentation will not be about cardiac asthma. No. It is going to be about bronchial asthma definitive diagnosis. Actually, there is no true diagnosis called cardiac asthma. Cardiac asthma is just the breathing difficulty that is as a result of heart failure. It is not a true asthma. But that is not the argument that I want to waste my time upon. The main issue is that we want to know how we can make definitive diagnosis of bronchial asthma. No wonder. The test is also taking a name after this, bronchial challenge test, to diagnose bronchial asthma, not cardiac asthma. Yes, it is a test, and it is meant to diagnose asthma, but that is not the only reason why bronchial challenge test could be done. That it is the main reason why it is done, to diagnose asthma. The first note I'm going to leave here is that I want to show you what we will go through here. We will define the test fully. What for? Who can do it? Who can perform the test, and on who? When can the test be done? How can it be done? Are we going to be faced with certain complications? Is there a way out if we run into trouble? What conclusion or conclusions can we draw from the test? When this person is going to be discharged, how? And what will follow after? All this will be addressed here. The diagnosis. This is just to quickly whet your appetite. This is what we are aiming at. The spirometry drop of 20%, if that is the case, that is diagnostic of asthma. Bronchial challenge test is simply a way to determine airways hyperresponsiveness or reaction, and thereby establishing whether or not the person being tested is asthmatic, and at the same time determine the severity of the same, meaning the severity of the asthma. In other words, you are trying to elicit a particular response, right? So you are sending in a particular chemical, and you want to watch out how the individual will respond to the new agent that has been introduced to his or her system. It is known by many different terms depending on what you are using to carry out the test. Some call it airway provocation test. You know, to provoke somebody, right? Either by words or by action or by enemies. The individual is just lying low, very quiet, and you have decided to stir up the anger in him or her, right? And you expect a reaction, right? The same thing you are doing here to the airway, okay? Bronchoprovocation test, that is another name. Methacholine challenge test, when you use methacholine, okay? Could be histamine challenge test when you use histamine. It could be Mannitol and specifically Aridol challenge test when you use Mannitol. There are different presentations on Mannitol already published by me recently. Okay, let me quickly address Mannitol right now because we've mentioned it. Mannitol Aridol challenge test. If you want to know more about Mannitol per aura, you can click on this very link. But if you are anxious or interested in knowing about Mannitol intravenously, then click on this very link. I know by mere hearing the word Mannitol, many people will quickly think about increased intracranial pressure reduction, cerebral edema treatment. If you want that, click on this. If you want information on Mannitol for this type of test or in cystic fibrosis as a mucolytic agent, click on this very one. Okay, asthma can begin at any age. Let's take that. Can be at age 2, age 3, age 4, age 5. Most children will start around the 50th year of life. But when it is occurring or is diagnosed in children, we call it childhood onset asthma. When it is in adult, most literature will put it at anyone older than 20 is adult onset asthma. It can be as old as 50 or 60 that the man or woman will be diagnosed with asthma for the first time. Yes, as old as that. While working towards retirement, suddenly you are diagnosed with asthma. Yeah, it's possible. Though it may not be asthma, it might be something else. We'll go into that also later on. Before age 5, asthma is not yet diagnosed by bronchial challenge test. No, it's not. Why that? We'll tell you in a bit. Treatment before age 5, since the definitive diagnosis has not been made before age 5, then how do we treat? Are we going to fold our hands and the child will be suffering? Definitely no. No, we're not going to do that. Based on signs and symptoms and strong family history, the child will be placed on rescue pause, like Ventolin. If it's very severe, we can add inhaled corticosteroids. So 60 to 70% of all cases will be diagnosed before adulthood. Yeah. If it's not asthma, it may be something else. So we'll keep our thoughts wide, think deep, we'll ask for more history, we'll do physical examination, maybe bronchiolitis, gastroesophageal reflux disease, rhinitis, sinusitis, pneumonia, COPD, cardiac asthma, pneumothorax, pulmonary embolism. No, the list just goes on. But the key here is that asthma can begin at any age, any age. But we cannot do the test to diagnose asthma at any age. It must be 5 and older. Uses of bronchial challenge test. It is meant to determine the acute flare-ups of inflammation and swelling of the lungs generally. okay? But mainly, we will adopt this test or send a patient to go and have this test mainly to diagnose asthma. It can be used to monitor asthma, okay, diagnose asthma and determine the severity, also for monitoring. In patients with chronic obstructive pulmonary disease and then having acute flare-ups, we want to know what is responsible for that. And cystic fibrosis, we want to determine lung functioning capability, right? You can have this test done. Now, materials needed will be spirometer, pulse oximeter, peak expiratory flow meter, nebulized Ventoline, that's short-acting beta-2 agonist, pulmonary resuscitation kit. Somebody will ask me, why this? Why no Ventoline? You know in a bit. Advanced cardiac life support knowledge and kit. Why that? You know in a bit. Arterial blood gas kit. You know very soon. Then you get your triggers. Okay? You need just one. You may go for Aridol, Methacholine, or Histamine. Now, some will get out of this, use cold air. All these things could trigger, hyperresponsiveness. By who? Only by experts. Pulmonologist, allergist, immunologist, pediatrician, not all pediatricians, the pulmonologist, okay? And pulmonary function technologist. The pulmonary function technologist will be the one in lab to do the pulmonary function test and so on, but will be supervised by the expert. When? Okay. Not done in first 2, 3, and 4th year of life, 5 years and older. Some will even say 6 years. Now, depending on the literature you are going through, some will say 6 years, but many jurisdictions will be okay with any child greater than 5 years. Then, it's not just any child greater than 5 years that you're going to grab and then take for bronchial challenge test. No, they must be having signs and symptoms of bronchial hyperresponsiveness, meaning wheezing, cough that is persistent, might be coming sporadically at night, or might not be at night, just persistent, right? They have chest tightness, shortness of breath, then it's related to environmental or toxic exposures, strong family history, and so on. That is when you start thinking that, okay, let me rule out asthma in this child. It's not all children that are 5 years that we're going to grasp and take for bronchial challenge test. It's those kids with this. Why age 5 and older? Well, pulmonary function test will be done correctly in a child that is 5 years and above, and the child will be able to tell if there are shortness of breath, wheezing, chest tightness, dizziness, headache, and so on. Contraindications. If you see the list of contraindications here, these will be pointing to two things: that it is not restricted to children alone. Then you might be doing bronchial challenge test for something else that is not related to bronchial asthma diagnosis. So pregnancy, though pregnancy can occur in teenagers, so anyone that is pregnant cannot have the test. High blood pressure, no. Aortic aneurysm, no. Myocardial infarction, no. Stroke, no bronchial challenge test. Pretest avoidance. All these things must be avoided before anyone that will go for bronchial challenge test will present to the expert. The reason is that we don't want anything to have triggered airway hyperresponsiveness before the onset of the test. We want the airways to be resting, and we will then provoke the airways, okay? So no cold air, no exertion. If you know that you are sensitive or allergic to particular allergen, then avoid that. No smoking and no smoke inhalation. Certain medications should be avoided, like any of the non-steroidal anti-inflammatory drugs. No use of bronchodilators close to the time, and transiently you should be off oxygen just about the time of the test. Okay, and if you're on long-term corticosteroids, well, even if you stop it on the day of the test, that will not count much. That's why I say plus or minus long-term use of corticosteroids. So how is this test done? First of all, it's going to be done in pulmonary function lab. Pulmonary function test will be done first, and it will be recorded as a baseline. Then it will be compared to the predicted values for that particular age group, the height and gender. Then that record will be kept, okay, and you could get that done through spirometry, body plethysmography, diffusion studies. And the next thing that will happen is the agent that will trigger the hyperresponsiveness will be given to you through nebulization. So either Mannitol, the Aridol, Methacholine, or Histamine, then you will inhale it through nebulization. The expert and pulmonary technologist will watch you closely, and they will record whether you have shortness of breath as you may launch your complaint, and then spirometry will be repeated. There may be serial testing. That might be the choice of the expert depending on whether he or she has reached conclusion. You can have the reversal of bronchospasm or bronchoconstriction with the help of bronchodilator. I think here we'll be making use of short-acting beta-2 agonists like Ventolin. But those that will carry out the test will be skillful in pulmonary resuscitation. Remember, I said earlier that ACLS knowledge and kit will be required because some can go to the other side, but they will do everything to bring him or her back. When spirometry record is showing drop of 20%, then the expert can say categorically that this individual is asthmatic. So spirometry drop of 20% is diagnostic of asthma. Complications. Generally safe for many, but there may be transient disturbances like wheezing, shortness of breath, and so on. And some may become so tired, some will feel dizzy, some can have headache. Certain conclusions could be done. Remember, we said there will be baseline pulmonary function tests, right? And that has been recorded. And post-testing pulmonary function test will also be recorded. Then you compare. The determination of whether or not this person is asthmatic will be made after that. Remember, when spirometry reading drops by 20%, that is diagnostic. That is the main reason why BCT will be done. Then, the physician will determine whether treatment plan will commence or not. Of course, when asthma is already diagnosed, treatment plan will be put in place. It may also conclude based on the main reason or reason for the test. Maybe what you are trying to do is to determine cystic fibrosis lung function capability. Then you can make that determination. Or you are monitoring asthma, or you just want to determine flare-ups in COPD. Discharge. This person is done with you, then we cannot just send him or her into the ward without being followed up. So we have to fix him or her or with a physician or the family physician if he or she had been referred by one earlier, and then instruct when you run into trouble what to do. All those things will be put in place, or you call 911. And lastly, let's go through other ways to diagnose asthma. I spent 18 minutes plus to take you through what bronchial challenge test is all about to make the definitive diagnosis of bronchial asthma. But what if you don't have the luxury of having the expert? Because it could be done only by the expert. You don't have the lab technologies, you don't have the pulmonologists to supervise. What are you going to do? So, in many parts of the world, in rural areas, remote parts of the world, people still depend on spirometry. Some will have allergy testing to know the precise allergic trigger or triggers. Some can have the bronchoprovocation using cold air or exertion. Some will use nitric oxide testing to determine whether this individual would need steroid use or not. And some will base the diagnosis and then subsequent treatment on strong family history in conjunction with the current signs and symptoms. For example, in a family where either the mom or the dad is a known asthmatic patient, and the first child, the second, or the third are already diagnosed with asthma, and the fourth one is also presenting with signs and symptoms of asthma, well, if you don't have bronchial challenge test done, I don't think it is out of place to start treating the first child as a child with bronchial asthma. With that, I've come to the end of this presentation on bronchial challenge test to make definitive diagnosis of bronchial asthma. Thanks for listening. Please spread this to everyone on your platform, in your school, at your place of work. I appreciate that.